Good morning. In continuation with the previous classes of case history and as a part of extra oral examination, today I'll be talking about lymph node examination. So the contents of my lecture include an introduction, lymph nodes of the head and neck region, principle of lymph node examination, an examination of various lymph nodes in the head and neck region, what all are the points that you have to keep in mind while inspecting the lymph nodes as well as palpating the lymph nodes, and finally the conclusion. So to begin with, I hope all of you would have already by now learned what is a lymphatic system and what are lymph nodes. But still, just to recap, lymphatic system is nothing but a part of your arteriovenous circulatory system. It is nothing but it is tissue fluid circulation, and it basically plays a major role in our immune system. And lymph nodes are basically accumulation of lymphoid tissues along the course of these lymphatic vessels. So you've got accumulation of lymphoid tissues at certain points, like, your check post points. At certain points of the body, you will have accumulation of these lymphoid tissues. And those are the areas where it's called as lymph nodes. Okay, and there are many reasons for these lymph nodes to be enlarged, ranging from benign conditions, infections, to even malignancies. So to rule out any sort of underlying disease which the patient might not be complaining of or showing any signs and symptoms, we as physicians or healthcare providers, it is our duty to examine lymph nodes as a part of our routine clinical examination. So moving on to the lymph node examination, what all, since we are dentists and dealing with the head and neck region, what all are the lymph nodes that we are supposed to be examining? So starting off with, you're supposed to be examining your submental group of lymph nodes, like you can see in this picture. Then moving on to the submandibular lymph nodes. Then you've got your buccal or your facial group of lymph nodes. Then in front and behind the ear, you have got your preauricular or parotid lymph nodes. You have got your post-auricular or your mastoid lymph nodes. And furthermore, posterior, you have got your occipital lymph nodes. All these positions have been shown in this diagrammatic image so that you understand how and where to place your fingers to palpate when it comes to a patient. Furthermore, you have got your supraclavicular lymph nodes and you have got your superficial cervical lymph nodes, and then the deep cervical lymph nodes of pretracheal, paratracheal, tracheal, and your retropharyngeal. Usually your deep cervical lymph nodes are not clinically accessible, and any pathological changes in your deep cervical lymph nodes are usually found out as a part of your investigative procedures, like maybe your ultrasound or your CT or your MRI. So what is basically the principle of your lymph node palpation? You, me, all of us who apparently do not have any sort of infection or any underlying systemic disorder will not have their lymph nodes palpable. So keep in mind, normally the lymph nodes are not palpable. So in a patient, if you do not find any lymph node that is palpable, it means the patient does not have any underlying systemic or some sort of infection that is there. All right, so it doesn't mean that there's any abnormality with the patient, that the patient does not have lymph nodes. It just means that the lymph nodes are normal. So these lymph nodes usually become palpable only when they are larger than 1 centimeter. Like I told you, there's a varying degree of reasons of these lymph nodes being palpable, from infections, which can be your ENT infections, which could be even your dental infections like a periapical abscess, or your pericoronitis, that is your third molar erupting. All these can also lead to lymph node becoming palpable. The patient itself will report saying that they're able to feel a sort of swelling somewhere around the neck region, and majority of the times it is you who will actually find out the lymph node that is being palpable. Okay, so when you examine lymph nodes, since these are all under your deeper structures like your superficial skin and within your muscle layers and all, you are supposed to be using only the pads of your fingers and never your nails. Because when you apply pressure using your nails, you have a tendency on hurting the patient. So use only the pads of your fingers for palpation in usually a rolling motion, and always apply steady pressure. And one of the major things that you have to always keep in mind is you should examine both the sides of the head in a systematic manner. So if you're examining your submandibular lymph nodes, always keep in mind that once you examine the right submandibular lymph node, make sure you examine the left submandibular lymph node immediately, and not in an order such that you examine your submandibular lymph node of your right side, go off to your pretracheal, preauricular, post-auricular, occipital, and all, and then come back to the left side, because you would forget what is the comparison between your right side and left side. Okay, so this is a very important point that you have to keep in mind. So moving on to the various lymph nodes and how do you palpate is what I'm going to be talking next. So kindly keep all these points in mind, because you're supposed to be examining all these lymph nodes on every patient that comes to your clinic to rule out any sort of underlying infection. So to begin with, we start with the submental lymph nodes. Okay, so submental lymph nodes are situated right somewhere down over here under your chin. So you, the examiner, is supposed to be standing behind the patient, and you're supposed to be asking the patient to tilt the head down towards the front. You can always use your non-examining hand to tilt the patient's or to guide the patient's head a bit down. You shouldn't push the patient's head with much force, but just guide the patient's head a bit down, because the patient shouldn't be lifting their head during the examination. And then you're supposed to be rolling the fingers, preferably your index and your middle finger or forefingers. Okay, forefingers under your chin, okay, with pressure against your bone. That is basically your symphyseal region. So this is exactly how you do it. All right. So next is your submandibular lymph nodes. So submandibular lymph nodes are present as right and left side. Okay. And the examiner, while examining the submandibular lymph nodes, are supposed to be standing behind the patient, and you should gently tilt the head to the side of the node to be palpated. Always keep in mind there are few nodes that you have to palpate in such a way that if you're examining the right side, the patient's head should be tilted to the opposite side. Okay, so here if you're examining the patient's right side, that is my right side, you should ask me or gently tilt my head to the side that is being examined, that is your right side, and you're supposed to be rolling your fingers against the inner surface of your mandible by applying pressure against the bone. Here again, you're going to use the pads of your fingers, your forefingers, okay, under the mandible, under the chin, under your neck, and apply pressure against the bone like this in a rolling motion. Okay, and submandibular lymph nodes are the most commonly palpated or incidentally found lymph nodes, especially when you have periodontitis, severe periodontitis, you've got grossly decayed tooth or root stumps, or even pericoronitis. Next is your parotid or your preauricular lymph nodes, which is basically like I showed you in your picture earlier. It is situated right in front of your ear, in your parotid region. So here you're supposed to be, the examiner is supposed to be standing right behind the patient, and you should gently tilt the head to the opposite side of the node being palpated. So keep in mind, in your submandibular, you're supposed to be asking the patient to tilt their head to the side that it is being palpated. And in parotid lymph nodes or your preauricular lymph nodes, you should ask the patient to tilt the head to the opposite side that you want to palpate. So if you want to palpate my right preauricular lymph nodes, you should ask me to tilt the head towards the left side and gently roll the finger in front of the ear, especially against the bone. So always, if it's like a bit more smaller lymph nodes, you will not get it immediately when you touch it. Especially if the patient is really having a bit more chubby cheeks, a bit more fat deposition, it will be kind of very difficult to palpate. So always roll your pad of your fingers, especially your 3 fingers in this instant, against the bone and feel for any swellings, which would actually be your preauricular lymph nodes. The next is your facial or your buccal lymph nodes. Here you're supposed to be standing at your 9 o'clock position. So if the examiner is not standing behind, you're supposed to be standing at the 9 o'clock position. That is either on this side or this side, depending upon which side you want to examine of the patient. And you're supposed to be rolling the finger at the cheek. Here the patient can be made to sit straight upright and use your index and middle finger, and you just need to roll like this. Always keep in mind, it is the pad of your fingers and not the nails that you use. Next is your post-auricular lymph nodes or your mastoid lymph nodes. Here, the examiner is supposed to be standing right behind the patient and gently tilt the head to the opposite side of the node to be palpated. So keep in mind, pre-auricular and post-auricular, the patient's head should be tilted to the opposite side that you want to examine. So right side means the patient's head can be tilted left side. Either you ask the patient to tilt or you can guide the patient's head by using the non-examining hand to gently tilt the patient's head to the opposite side to be palpated and roll the finger again behind the auricle against the mastoid process. So all of you will know where your mastoid process is. So you're supposed to be rolling the fingers behind the auricle against the mastoid in a rolling motion using the pad of your fingers. And this is exactly the similar procedure that you use for your occipital lymph nodes, like I showed you in your diagrammatic image that initially, if this is the area where you have your post-auricular lymph nodes, it will be a bit more posterior where you will have your occipital lymph nodes. And like I told you, you have your pre-auricular on both sides, some mandibular on both sides. So whichever lymph nodes are present on either side, always make sure you finish the right side and immediately do the left side and then only go to the next category of lymph node. So once you finish the right and left submandibular lymph node, only then go to the pre-auricular lymph node, finish the right and left of the pre-auricular lymph node, and then only go for the facial lymph node. So that's how it's supposed to be continuously followed. Now moving on to the superficial cervical lymph nodes. Okay, so everybody knows the cervical region. So the superficial cervical lymph nodes, you can palpate it by standing right behind the patient like shown in the picture. And you're supposed to be first locating your sternocleidomastoid muscle. And you can palpate it using 4 fingers above the sternocleidomastoid muscle using a rolling motion. So everywhere basically lymph node examination is being done using a rolling motion. Okay, so above the sternocleidomastoid muscle using a rolling motion, you can use your 4 fingers and palpate it. And if it is positive, it means your superficial cervical lymph nodes are actually palpable. The next comes your upper deep cervical lymph nodes as well as your middle deep cervical lymph nodes. They're usually often inaccessible. However, in case it's like very large in size, you can always palpate them by standing behind the patient, okay, and by hooking the thumb and the fingers around on either side of the sternocleidomastoid muscle. Okay, so like this. Okay, and you can use a rolling motion for your upper deep as well as your middle deep cervical lymph nodes. So once this is all about the palpation. So this is all as to how do you, that is the examiner, stand and palpate. Okay, so but what are the points that you're supposed to be inspecting and what are the points that you're supposed to be palpating is what I'm going to be telling you next. So always inspection is only then followed by palpation. So in inspection, you're supposed to be checking out for the number of lymph nodes that are visibly enlarged. Okay, the position of the enlarged lymph nodes, whether the size and if they are the skin over the lymph nodes is erythematous or there's some sort of discharge from there, and if there is any pressure effects because of these enlarged lymph nodes. Now, following it, I told you each group of lymph nodes as to how you palpate. But while palpating, what are the points that you have to keep in mind, or what is it that you're supposed to be noting is the tenderness, if the patient has any sort of tenderness while palpating any of these lymph nodes, and if there, what is the temperature, if there's any temperature rise or not, consistency, and if there is any matting of the lymph nodes, and finally the fixity of the lymph nodes to the underlying structures. So starting with inspection, like I told you, it's always inspection, then only followed by palpation. So in inspection, I told you the first thing is the number. So sometimes, lymph nodes will be palpable in a localized manner or it will be in a generalized manner. So localized manners are usually related to infection, especially in the vicinity of the infectious area. Like if it is the pericoronitis, your submandibular lymph nodes are what will be palpable, especially in the affected site. So if the patient has pericoronitis in your 4-8 region, it will be your right submandibular lymph nodes that will be palpable. All right, because it basically corresponds to the area where that infection or that structure drains to. Now, generalized lymph node palpable, being enlarged. Okay, it happens usually more in systemic conditions like your TB, your leukemia, or secondary syphilis. Like you can see in this picture where the patient has got submental, submandibular, even the axillary lymph nodes are all visibly enlarged. Basically, they are all palpable. So this all shows there is some sort of a systemic underlying disease. Now moving on to the position of the lymph node. Position of the lymph node gives you pathognomic information about the diagnosis as well, because usually certain lymph nodes are enlarged or palpable at certain sites. Actually, you should be more suspicious of a particular disease, like your cervical lymph nodes, especially in this picture as shown here. You can see there's a very large cervical lymph node. You do not know whether it's one or two because there could be matting, but this area is most typical of tuberculosis. Okay, so TB patients will usually have such enlarged cervical lymph nodes. If the inguinal lymph nodes are palpable or enlarged, it is usually because of filariasis, and in secondary syphilis, it's usually the epitrochlear and the occipital lymph nodes that appear enlarged. If I even keep telling you palpated in your inspection, kindly keep in mind all your palpated lymph nodes, if they are very large in size, you can see them on inspection itself. But sometimes when the size has become big, like it is palpable, that is just more than 1.5 centimeter, but however not very large in size, you will not be able to visually see it, but you will be able to palpate it. But it still means that there is some sort of a lymphadenopathy. Now moving on to the skin of the swelling. Skin over the swelling gives you a brief idea regarding the internal changes within that lymph node. So in case of acute lymphadenitis, you'll be able to see the skin very inflamed with erythema and edema and induration. And in case of rapidly growing lymphosarcoma, the skin will be very stretched, that is basically to be tensed. It'll be shining, especially like, when you see the skin shining when it's like very stretched, and you'll be able to see the dilated subcutaneous veins. And in case of secondary carcinoma, it'll be initially free, but later on it gets fixed. That is the skin overlying the lymph node, enlarged lymph node will usually be free, but later on it gets fixed to the lymph node. Now moving on to the last point that you have to note as part of your inspection of lymph nodes is your pressure effects. So excessive enlargement of these lymph nodes, especially these are all present around few vital structures. Okay, so since we deal with head and neck, we have the vital structures of your airway passage as well as your esophagus and all. So around those regions, if your lymph nodes have become excessively enlarged, it can lead to dyspnea or dysphagia of the patient. Dyspnea is nothing but because difficulty in breathing, especially not because of any other reason, but because of an enlarged lymph node putting pressure over the trachea or the bronchus. And dysphagia is difficulty in swallowing by the patient, which is basically because of an enlarged lymph node applying pressure or putting pressure over the esophagus. So these are all the points that you have to note down when you're inspecting any sort of changes, pathological changes in your lymph node. So moving on to palpation, I told you the techniques of palpation of each of your group of lymph nodes. Now, what are the points? Is the first thing that you're supposed to be checking is tenderness, whether it is painful for the patient when you are palpating it or not. That's why I keep telling you to avoid a false positive. Kindly do not dig your fingernails into the patient's skin, especially if you have nails. Okay, you're not supposed to be digging your nails into the patient's skin, because that can actually lead to pain, and the patient will say that yes, it is paining. You might think that there is tenderness in the lymph node when actually it is not, because of your faulty palpation procedure. So tenderness is basically nothing but a sign of acute inflammation. That is, it's an acute infective reaction present within that lymph node. Now temperature, usually temperature changes, that is compared to the other parts of the head and neck structure, that area where the visibly or usually where that lymph node is enlarged, there could be a local rise in temperature. That is also again a pathognomic sign of any underlying infectious cause. All right. Now, the next thing that when you palpate, like I told you in TB, you might see a very large mass of the lymph node, but you'll never be able to know whether it's just a single mass or whether it is multiple lymph nodes that have been matted with each other or not. So adjoining nodes becoming matted, if there is periadenitis present, that's very pathognomic of tuberculosis. However, in metastatic carcinoma also, you'll be able to see lymph node matter. The next 2 points are very important. One is your consistency and the other one is your fixity to your surrounding structures. Consistency is nothing but what you feel when you palpate those lymph nodes. Okay. Here again, few diseases have pathognomic consistencies of your palpable lymph nodes. Like in Hodgkin's disease, it's always soft and rubbery. So when you palpate the lymph node, it must be a routine extraoral examination, and you're able to feel a lymph node that's palpable. But the moment you feel that it is soft and rubbery, kindly keep this one disease at the back of your head and kindly investigate further, so that you may never know that, on a routine extraoral examination, you may actually be the person who must be the first one to diagnose the patient of an underlying life-threatening disease. All right. So in syphilis, usually the lymph nodes which are palpable will be firm and discrete. And in secondary carcinoma, they'll be very stony hard. So this you will come across very commonly, because when the patient has oral carcinoma or any dysplastic changes, if the carcinoma is really spread quite a lot into the deeper structures, the lymph node will definitely be palpable. It need not be visibly enlarged, but it will be definitely palpable. The patient might have tenderness. Mostly it will have tenderness, but however, it is very characteristic that these lymph nodes will be stony hard in consistency. Now, next you have variable consistency of soft, firm, and hard in different conditions. Like usually if it's just a pericoronitis or a periapical abscess, usually the lymph nodes will be just soft. On a chronic dentoalveolar abscess, the abscess which is kind of very chronic, the lymph nodes might turn out to be much more firm. But if you find of any of these pathognomic features, you have to always think in terms of a different underlying systemic disease. Now, moving on to the last point that you have to keep in mind while checking the palpation of your lymph nodes is your fixity to your surrounding structures. Usually all your lymph nodes that are palpable will be freely movable. Whether it's your ENT infection, whether it's a reason because of your dental reasons like your chronic periodontitis, etc., etc. All these lymph nodes that are palpable might be tender. There might be a temperature raise, but invariably all of them will be freely movable. The moment you feel that any of that lymph node, that is any of that swelling, is not freely movable, it means that it is basically fixed to the surrounding structures, which is definitely indicative of some underlying malignancy. It could also be a secondary metastatic lymph node. The patient might have a carcinoma somewhere else in the body, but you as a dentist, while examining, you might find lymph nodes here which does not correspond to any other source of draining structure in the head and neck region, because of which you can actually refer the patient to a physician, and on further examination you may never know, the patient might come out with some other underlying systemic disease. And always keep in mind, these patients will be forever grateful for you, because you might be the first person who would have actually diagnosed the patient even before any sort of early signs or symptoms became even visible to the patient. So to summarize the entire thing, lymph node examination does come as a part of your case history under your extraoral examination. Though we are very time constricted while we're examining a patient, lymph node examination is kind of very important. In fact, every structure in examination is very important, but lymphadenopathy can be associated with a wide range of disorders. It could be even benign or even malignancy. So whenever it is a malignancy and the patient wouldn't have had the signs or symptoms, imagine you palpating a lymph node and making the patient undergo further testing and finally coming to a diagnosis of a malignancy. Yes, it will be devastating for the patient to have a life-threatening malignancy, but they will always be forever grateful that you have actually helped them diagnose or find the disease at the earliest stage. So discovery, if you ever come across any enlarged lymph nodes, kindly examine thoroughly the head and neck region for any of the draining structures to that particular area that could actually be a cause of that infection to lead for that lymph node enlargement. Otherwise, kindly refer them off to a physician so that further investigations can be done to find out the underlying cause. I hope the importance of lymph node examination is very clear, as well as the positioning, because you're supposed to be doing this procedure for all the patients that come to your clinical practice. Thank you.